I am Dr. Vijayvardhan, a dental and maxillofacial surgeon, or it's also called oral and maxillofacial surgery. This is a relatively new branch of medicine and dentistry which originated when World War was happening, and then there were major casualties which involved face as well. And there was no specialty which was dealing with the face exclusively. There were plastic surgeons, there were orthopedic surgeons, there were dentists, but there was nobody who was treating face as a unit and treating it. So then this branch came up basically through dentistry, because dental occlusion is primary point from where the face is reconstructed after an event of an accident or trauma to face. So we primarily deal with trauma to face, that is accidents. When an event of an accident, the bones of the face get distorted or fractured, and then they are rearranged to their original form, is one part. And the second part is the tumors or pathologies of face and mouth and jaw region. So when there are tumors or any kind of diseased parts or diseased lesions or diseased things in the jaws or face and mouth, so we remove them and reconstruct that diseased part with other parts of the body, like from bone from elsewhere or tissue from elsewhere of the body. And the third one is when you are very good with dealing with trauma, that are broken ones, to rearranging them to original form, and then when you are removing something which is bad from the body as face and then reconstructing it, cosmetic surgery becomes easy. So cosmetic surgery is basically intentionally you break something and reconstruct it to the desired aesthetic, more beautiful kind. So these are the three things. One is trauma or accidents, and second, pathologies or diseased parts of face and mouth and jaws, and third part is reconstruction or beautification or cosmetic surgery of face, mouth and palm. This clinic was started in 2008, and the main intention of me starting this is, like, we have plastic surgeons, we have dentists, but there are nobody who deals everything as a unit and give a very pan facial approach, I call, like as a unit and giving a good look. So that is how we named also it as Face and Teeth. And my friend Dr. Pawan Kumar, who is an orthodontist, along with him we started this, and this is almost 10 years now. The specialty of this clinic is, what we do is anything of mouth, any cosmetic surgery or any regular general dental procedures. And most of the time what happens, a dentist does a root canal, for instance, and then after the root canal, like, what he can do is nothing. Whereas a surgeon, even after a root canal, he can perform a surgery to remove infection under the root through the bone and then repair it, and the life of the tooth extends. For example, that is one example of what a surgeon can specially do beyond a general dentist. Cosmetic, like smile designing, and when we design a smile, we actually keep in mind about the face as well, and complete face is taken and then a pan facial approach is given. What does that mean? Like, when you smile, teeth are the three things most dentists deal with, and they say that it is smile design. But when I do it, like, it's not just teeth. When you smile, you are using your lips, you are using your muscles which pull your lips apart, and then the chin, and then the whole face as unit, and even nose. For some people, when they smile, the nose gets pulled, so that results in a very abnormal smile. So when we deal, we also do procedures on nose, on the fillers to fill the nasolabial fold or these folds when you laugh or laughing smiles, and the lips, when they are very thin or very thick, also results in a bad smile. So the surgeries to enhance or reduce the lip size is also done. And finally, the result is, when you smile, you see teeth. So teeth are given proper shape and color, and apart from teeth, gums are another very important structures which are visualized when you smile. So the shape of the gums, the color of the gums, the size of exposure of gum is also taken care.
నా పేరు భాస్కర్ లక్ష్మి, నా వయసు 54. మేము పక్కన అమీర్పేటలో ఉంటాము. ఇక్కడికి వచ్చిన తర్వాత పళ్ళు నొప్పులు అవి తగ్గాయి, ఆయన ఇచ్చిన మందులు, అది క్రీమ్ వల్ల.
And another very special technique which I have acquired through these 10 years is fat transfer. I have a very peculiar, very special kind of fat transfer technique which requires just 30 minutes and uses minimal equipment. Usually surgeons require very complex equipment to extract fat and then process it and re-inject into face. But I have developed a technique which involves just 30 minutes to extract and re-inject into face, and also this procedure requires minimal equipment. So this I am actually trying to put it as a research paper, and then these are some of my future plans. One is to go with this fat transfer research, and second, I also want my 10 years of experience to be spread everywhere. So I am taking this further internationally. So I might start similar kind of centers in Canada and elsewhere also. So Canada is my first step probably, and hope everything will go well.